Well, I'd also just like to thank the incredible health staff at the front line at Royal Prince Alfred Hospital, Hub, Westmead and also Liverpool. There's an incredible energy and buzz at each of these hubs as the frontline quarantine staff and health staff are coming in for their vaccinations. And I can assure the community that the medical community is very keen to get their vaccinations, and so the broader community should also be, in due course, very keen to get their vaccinations. I think I've said before that we have roughly about 6,500 staff in any 1 week looking after our quarantine systems, our quarantine hotels and our health hotels. Pleasingly, only a week and a half into our rollout of the Pfizer vaccine, we've already vaccinated 4,200 of that 6,500. So to have achieved that, 2/3 of our frontline quarantine staff is certainly addressing the issues that Dr Chant has regularly talked about and just spoke about again, and that is making sure that our frontline staff have the vaccination to make sure that we effectively ring fence the people who are coming in from overseas who unfortunately are all too frequently carrying the virus or a variant of the virus. I have no doubt that the federal government will, in due course, give us the information that we need, as the Premier said, to continue our planning for the rollout across the state. But we are looking forward to getting information from the federal government as to the precise numbers of people who have thus far been vaccinated in our aged care facilities. And indeed, we're looking forward to understanding which of the aged care facilities have actually had their teams in there vaccinating the residents. As we understand it, they're not vaccinating at the moment, even the ones that have attended, the staff in those facilities. So we're looking forward to seeing from them a program going forward of how many of those staff will be actually vaccinated, when they'll be vaccinated, so that we can factor that into our overall New South Wales health response to make sure that we roll out the vaccine to our entire eligible 6 million people across New South Wales. I think it's fair to say that the rollout of vaccines in a 100-year pandemic is extremely complex. And of course the federal government have been very active in obtaining those vaccines in very trying times. So the vaccines having come to our shore, they are now obviously working with states and territories, and we are trying to work with them to roll out those vaccines as expeditiously as possible. But it is necessary for us to be able to do that, to have full exchange of information, full transparency, and we've expressed that, I've expressed that to Minister Hunt and to the federal government quite clearly. It's a matter for other ministers to comment on that around the country, but there have been other ministers who I understand, or I know, have indicated similar issues to the federal government, to Minister Hunt.
Minister, what sort of pressure is that putting on?
Hang on, guys, I'll just finish, please. Just whoa. Also, in relation to the ADF issue, as I've said previously, it would be really helpful if we were now given a letter of confirmation of what was apparently given to the media yesterday, and a plan and a schedule to understand exactly how the ADF are going to work in New South Wales, so that as our health teams, who are world-class, can then proceed to establish what their role is in determining how we move forward. Sorry, you were going to say.
Minister, you still have nothing in writing from Canberra confirming that the ADF are helping with this rollout?
I have nothing.
And Minister, what sort of pressure is that putting on, say, aged care facilities who are perhaps preparing for the vaccine to come and waiting?
Look, these are issues which obviously are logistical issues that have caused a degree of grief, genuine grief, in aged care facilities across New South Wales. Certainly I've been getting reports of folks who are sitting there waiting for their vaccine. And to aged care residents and those who are older in the community, those who have other health issues, have been stressed beyond belief in the last 12 months. It would be helpful if there was clarity and certainty and actual delivery on that prospect, so that they don't have their grief and anguish added to. So I think there's a lot of work to be done on that front.
Minister, how are you deciding in New South Wales who gets Pfizer and who gets AstraZeneca? Is there a distinction, or is it just trying to get these first two groups done as quickly as possible?
At the moment, the original plan off 1A and 1B was to move forward with Pfizer, obviously, principally. But now that the federal government have been so successful in getting the AstraZeneca into Australia, the expectation is that the AstraZeneca will be able to be used to assist us in those early groups. But again, we literally are just receiving that information. We need to have more detail on precisely when the various doses are going to arrive here, so that we can have our health teams work on how that will be delivered. But it's principally the same groups. It's obviously at the moment, our quarantine workers, our frontline health workers, but as the Premier said, we're also rolling out into other areas, particularly the two new hubs that she just referred to, and the other ones that we referred to last week in regard to the regional areas, Wollongong and Newcastle. So the expectation is that AstraZeneca, the use of AstraZeneca will be making it easier in a sense, because clearly it doesn't have the same refrigeration problems or challenges. So we would expect if we get more AstraZeneca and we have a clear line of sight on precisely when and where it's going to be available, that we would be very happy to accept that and move forward with those groups.